Hello everyone, myself Tulsi Patel. I am working as nursing tutor at Knowledge Institute of Nursing. So today we will study about physical examination of mouth and neck. So about mouth, so it consists of mouth and oropharynx, lips, and that are inspected for symmetry and surface abnormalities, means any lesions or cracks. Then next is color. What are the color of lips? Means dark lips, bluish discoloration of lips, and pink, etc. Then edema. If patient is having facial edema or puffy cheeks or mouth or anything, we have to inspect it for it. Then what are the normal findings? That there is no visible margin. Then symmetrical in appearance and movement. The person can able to do all the expression which we are asked for. Then it is pinkish in color and there is no edema. The next is palpation. So palpate the temporomandibular while the mouth is open, wide, and then closed for. Then the things we are observing is crepitus, deviations, and tenderness. So what are the normal findings? It moves smoothly and there is no crepitus. Then no deviation noted. There is no any deviation of other than the normal finding. Then there is no pain or tenderness on palpation and jaw movement. If person is having pain or tenderness, you have to report it to the physician. Then gums are inspected for color, bleeding, and retraction of the gums. There are various disorders which indicate there is gum bleeding or gingival bleeding, and you have to observe for any lesions. Then what are the normal findings? The gums are pinkish in color, and there shouldn't be any gum bleeding. Then no receding gums. So inspect it, and if you find out any abnormality or any complaints like gum bleeding or gingival bleeding, you have to note it down and report it to the physician. Then next is teeth. So teeth are inspected for number. What are the number of the teeth and color of the teeth? There are sometimes white discoloration on the teeth, which is called fluorosis. Then dental caries, then dental fillings, alignment, and moleculisms. So two teeth in a space for one or overlapping of the teeth. You might have observed this many times. Then next is tooth loss, and which should also be assessed during the process. If the person is having bad teeth, which is called halitosis. The next, what are the normal findings? Then 28 for children and 32 for adults. Then white to yellowish in color with or without dental caries and or dental fillings, and with or without moleculisms, and no halitosis noted. So if person is having bad breath, which is called halitosis, you have to report it to the physician. Tongue is palpated for texture, and normal findings are pinkish with white taste buds on the surface, and no lesions noted, no varicosities on ventral surface. Then frenulum is thin and attached to the posterior one-third of the ventral aspect of the tongue. Then gag reflex is present. We are assessing vagus nerve for the gag reflex. Then able to move the tongue freely and with strength. Surface of the tongue is rough. Next is uvula is inspected for position, color, and cranial nerve tank, which is called vagus nerve. It is tested by asking the client, say note that the uvula will move upward and forward. So normal findings are positioned in the midline, pinkish to red in color, no swelling or lesions noted, moves upward and backward when asked to say Tonsils are inspected for inflammation and size. A grading system used to describe the size of tonsils can be used. So the grade 1 is for tonsils behind the pillar. Grade 2 stands for between the pillar and uvula. Grade 3 stands for touching the uvula. And grade 4 means in the middle, which is the severest. The next is neck. The neck is inspected for position, symmetry, and obvious non-visibility of the thyroid gland and jugular venous distension. So normal findings are no, the neck is straight and no visible mass or lumps. It is symmetrical, no jugular venous distension suggestive of cardiac congestion. So you must have to observe it very precisely. And if you find out there is a GVD, you have to report it immediately because there is cardiac congestion. The neck is palpated just above the suprasternal node using the thumb and the index finger. So the neck is palpated just above the suprasternal node using the thumb and index finger. So what are the normal findings? This is how you are assessing the trachea. So the trachea is palpable. It is positioned in the line and straight. The MPH nodes are palpated using palmar tips of the fingers via systemic circular movements. We select the lymph node in terms of size, regularity, consistency, tenderness, fixation to the surrounding tissue. If there is any enlargement of lymph node, you have to further go for biopsy and it may be indicative for any cancerous growth. So the normal findings are it may not be palpable, may be normally palpable in thin planes, no tender if palpable, formed with smooth rounded surface, slightly movable, about less than 1 centimeter in size. So the thyroid is initially observed by standing in front of the client and asking the client to swallow. And palpation of the thyroid can be done either by posterior or anterior approach. You will study in the lab. So thank you so much for the attention.